topic is Staphylococcus aureus. These organisms are very important for us to study because they are the ones that are involved in pyogenic infections of the human beings. They are a gram-positive organism appearing in a grape-like clusters under the light microscopy, and they are the one mostly involved in the localized suppurative lesions, that is the pyogenic infections. And these organisms are very helpful for us to study because they have developed resistance against different types of antibiotics, thereby making our treatment very difficult and leading to variety of pyogenic infections in the human body. And emergence of the resistant organism in the hospital also enables us to know about the different antibiotic resistant organism which are the one that are causing pyogenic infection in the hospitals, usually involved in the post-operative abscesses. So these organisms are gram-positive in nature, first discovered or identified by von Recklinghausen in 1871, involved in the human pyogenic infections. It was Pasteur who was able to isolate this organism from the pus and was able to initiate abscesses in the rabbits, help us to know about the activity of this organism in the pyogenic infections. Next, Sir Alexander Ogston gave us the causative role of this organism in the human pyogenic infections and named them as staphylococcus. Staphyl means bunch of grapes and coccus means berry. They look like a bunch of grape or berries under the light microscope after staining them with the gram staining. And these organisms are usually the one that produces different types of pigments on the nutrient agar media or the normal ordinary media. So the virulence is not in association with the type of colonies they usually produce. It was Rosenbach who had discovered the production of these pigments by the organism in the normal media. So he gave them the names, that is the Staphylococcus aureus, Staphylococcus albus respectively. So the Staphylococcus aureus are the one that produces yellow colored pigments on the normal media, and the albus which is a normal human normal flora produces white color colonies. There are another group of Staphylococcus called as Staphylococcus citrei, which produces lemon yellow colonies. But later on it was found that there is no relation between the virulence and the production of the colonies. Now there are different variety of factors that are usually are indicators of the virulence of this particular organism. First and foremost is the hemolysis. So when these organisms are grown on a media containing blood of the sheep, they usually causes the lysis. So based on the hemolytic pattern, you can identify the organism and its virulence characters. Next is they bring about the gelatic liquefaction. They liquefy the gelatin. They are lipolytic in nature. They produce urea. They produce phosphatase, and the most important one is the coagulase. And next is they ferment mannitol. So all the indicators such as the hemolysis, gelatin liquefaction, lipolytic, urease production, and phosphatase are indicators, but they are not mostly reliable. So nowadays we can the most reliable features of this organism to identify them in the laboratory is the coagulase test and the mannitol fermentation. And mannitol is fermented only by the Staph aureus, but not by the other group of Staphylococcus organism, and hence that also cannot be taken into consideration to know the identity of the organism. Now coming in detail about the different kind of staphylococci, as we know that these organisms can be involved in the pyogenic infection, or some of them are the normal flora of the human body. The most studied one is the Staphylococcus aureus, that is involved in the pyogenic infection. So basically we can classify the Staphylococcus aureus into two major groups. One is the Staphylococcus aureus and Staphylococcus epidermidis. Coming to the Staphylococcus aureus, the characteristic feature of this, it is involved in the pyogenic infection. It is coagulase positive and it ferments mannitol, and it is pathogenic in nature, causing different pyogenic infections in the human body. Now coming to the epidermidis, it is coagulase negative, it does not ferment mannitol, and it is non-pathogenic, and it harbors on the human body as a normal flora or the normal flora of the human body. And together these organisms are usually 32 species having 15 subspecies, and 3 of them are coagulase negative. One is as epidermidis, next is hemolyticus and saprophyticus. Apart from this, there is a staph hominis and staph capitis, which are the normal flora that do not cause any type of infection on the human skin. And coming to in detail about the staphylococcus aureus, because this is the one that is involved in pyogenic infection and most studied one, as they have developed resistance against different types of antibiotics. So the morphology of this organism is we will be studying them in different topics, that is the subtopics about the characteristic features of this organism. First is coming to the morphology of the organism. These are staphylococci. Cocci means nothing but they are spherical in nature and of about 1 micrometer in diameter, and they divide in one plane or to form a grape-like cluster, 2 to 3 planes giving grape-like cluster, but long chains of these cells cannot be seen. And some of these organisms are capsulated while some may be non-capsulated, and the capsular material are seen in only few strains of these Staphylococcus aureus and prevents them from phagocytosis. And these usually stain with gram-positive or that is with the gram staining, they are gram-positive, appearing purple in color, and when these organisms are treated with penicillin such as antibiotics such as penicillin, they can lose their cell wall forming the L forms. So this is about the morphology of the organism, and how do you identify them under the microscope is they are gram-positive, purple in color, and they are usually grape-like structure. The basic difference between Staphylococci and Streptococci is Staphylococci appears in grape-like clusters because they divide in 2 to 3 plane and the daughter remaining with the parents, whereas Streptococci are a chain of cocci that divides in one plane and remain in the linear structure. Coming to the cultural characteristics, how do you identify them or how do they grow in the artificial environmental media? They can grow in the ordinary media. They are not fastidious organisms, and they require a temperature from 10 degrees to 42 degrees centigrade, the optimum being the 37 degrees centigrade, and they require a normal pH of around 7.4 to 7.6, and they are aerobes and facultative anaerobes. Aerobes are the one that requires oxygen for their growth. And coming to the growth of this organism in different media, first coming to the nutrient agar, which is a basic media. Here the growth of the organism can be seen in the form of colonies, and the colony characteristics is helpful for us to identify in the initial identification of the organism. So these organisms on the nutrient media appear as large, circular, convex, smooth, shiny, opaque, emulsifiable, showing golden yellow pigment because it is Staphylococcus aureus. The characteristic feature of the Staphylococcus aureus is the production of golden yellow pigment on the nutrient agar. Now coming to the nutrient agar slope, in the case of nutrient agar slope, they usually show confluent growth, and the appearance is similar to that of a oil paint like appearance that can be seen in the slide. Next is the growth of the organism in a selective media. Selective media, that is a basic media, helps us to identify the organism in the initial stages. The organism which can grow in ordinary media can be grown in the nutrient agar, but the organism which are fastidious in nature have to be grown only in the selective media. So once they are growing in the ordinary media, they have to go about with the selective media for the final identification. So these organisms being hemolytic in nature can be grown on the blood agar media, and because they are pyogenic in nature, we can grow this organism in the blood agar medium containing 20 to 25% of carbon dioxide. So based on the hemolytic pattern, you can identify the group of these organisms. Next is the differential media, which is a McConkey media. Here the organism will be seen as pink colored colonies because of the fermentation of lactose, and next is you can go with the liquid media. The turbidity of the media can be in the form of uniformity can be seen in the liquid media, and next is the selective media to grow only these kind of organisms. So these organisms requires 8 to 10% of NaCl. They very well grow in a medium containing 8 to 10% of NaCl, which is called as a salt agar, or you can go with the salt mill agar to identify the organism from the feces, which are which can be usually seen in the pyogenic infections or systemic infections. These organisms usually causes localized infection, but sometimes can become systemic due to the entry of the bacteria in different parts of the body when they enter the blood, which is called as a bacteremia. Next is you can grow them in the lithium chloride or tellurite medium, which is also called as a Ludlam's medium, where they can be easily identified by their growth, and also can be grown in a media containing polymyxin. And the RBCs that are mostly used in the blood agar are the sheep's blood agar or the sheep's RBCs, but not of the human RBCs, because human RBCs might contain antibodies. So it is the sheep RBCs that are mostly lysed by the Staphylococcus aureus. Coming to the biochemical reactions, these organisms can be identified. They usually ferment many sugars but do not produce gas. So they are acid producers but no gas producers, and they are usually MR and VP positive but indole negative, and they are coagulase positive, which is one of the characteristic feature of these organisms, and they can ferment mannitol. Only Staphylococcus aureus species in Staphylococci are the one that can ferment the mannitol, whereas the other strains or the species do not ferment the mannitol. So in order to identify the Staphylococcus aureus, fermenting mannitol or mannitol fermentation is a characteristic feature, and they show clear hemolysis when grown on blood agar, and the production of the pigment, that is a yellow pigment, helps you identify this organism, that is a Staphylococcus aureus, which produces yellow pigment. The production of phosphatase can be known when the organisms are growing in a normal media, nutrient agar media containing phenolphthalein diphosphate. When the organisms are exposed to ammonia vapors, they produce pink color indicating the phosphatase production. Next is these organisms can be grown on a potassium tellurite medium, where they can be easily identified by the production of black colored colonies. And the unusual feature of the Staphylococcus aureus is the thermostable nucleases. So the nucleus activity is retained even after boiling, and they can easily degrade the DNA. Now coming to the resistance, the phenomena of resistance helps us to know to what extent the organism is resistant and helps us in treating purpose. So once we know about the susceptibility and the resistance of that organism, this characteristic feature can be used in the treatment of that particular disease. So these organisms are mostly resistant in nature, and they are, though being non-sporing, they do not produce any spore, they are highly resistant in nature. And on a dried thread, they can survive up to 3 to 6 months, and in a dried pus, they can survive up to 2 to 3 months. And the thermal dead point of this organism is 62 degrees centigrade for 30 minutes. That is, very high temperature is required to kill this organism. There are certain strains of organism that can survive up to about 80 degrees also, and they happily grow in a sodium chloride medium containing 10%, and they resist 1% phenol, that is, they are resistant to 1% phenol, but they are sensitive to 1% mercury chloride, and they can be easily inhibited by fatty acids. So highly unsaturated fatty acids can kill the coagulase positive organism, and they show equal resistance towards the lysozyme. Lysozyme is an enzyme that usually inhibits the organism by acting on the peptidoglycan layer. So these organisms have developed resistance towards the lysozyme, and they are sensitive to lysostaphin. It is a complex enzyme or a combined enzyme produced by Staphylococcus epidermidis. So the Staphylococcus epidermidis produces this lysostaphin, which is sensitive towards this Staphylococcus aureus, and most of the organisms initially were penicillin sensitive, but nowadays there are certain strains that have developed resistance against the penicillin. The development of penicillin resistant organism is usually attributed to 3 important characteristic features that the organism has applied itself to become resistant towards that particular penicillin. First is certain strains which are penicillin resistant produces beta-lactamase. Beta-lactamase is an enzyme that usually cleaves the beta-lactam ring, that is antimicrobial in nature. So it is in the penicillin there is a beta-lactam ring that is having the antibacterial activity. So the organism have developed an mechanism by which they they produces beta lactamase, and this lactamase can go and inactivate the beta lactam ring. So there are 4 different types of beta lactamases that are produced from A to D, the potent being the A1, and it is usually carried on the plasmid, and the plasmid borne beta lactamase enzymes, and they can be transferred via transduction or the conjugation. And the development of resistance can also be brought about by changing the surface receptor. So usually when the penicillin or any beta lactam ring is given, they go and act on a certain receptor of the organism. So these organisms are so smart enough that they have changed the receptor and not allow the detection of these receptors by the beta lactam ring. So the emergence of the epidemic methicillin staphylococcus aureus is a reason because of the change in the surface receptors of the organisms. They are not allowing the beta lactam ring to identify their receptors. Third is some of the strains have developed resistance, that is a tolerance against the beta lactam antibiotics. That is, they are not killed, but they get inhibited by in the presence of this beta lactam ring or the beta lactam containing antibiotics. So these are the 3 reasons how the penicillin resistant organism has emerged. Mostly in the case of hospital environments, you can see that is the continuous usage of this penicillin makes most of the organism resistance to different types of infection, different types of development of different types of organism which are resistant to different antibiotics. Now because of this resistance, it has even extended to other types of antibiotics such as erythromycin, tetracycline and aminoglycosides. Now coming to the pathogenesis and virulence of this organism, how this organism is able to cause the infection. Pathogenesis is the ability to cause the infection, and virulence is the degree of the pathogenicity, to what extent it can cause the infection inside the body. And there are different virulence factors that determines the virulence of the organism and the pathogenesis of the organism. So this organism can cause the pathogenesis or the virulence can be determined in 2 ways. One is the infection, they can cause infections or intoxication. Infection is the ability of the organism to grow and cause the disease, whereas intoxication is the ability to produce certain types of enzymes that usually causes the pathogenic disease in the human beings. So coming to the infection, here the organism gains an access to the human body. They usually via the damaged skin, they usually attach to the mucosal or the skin surface tissues or the proteins, and they colonize, they evade host defense mechanism, and they multiply and causes ultimately a tissue damage. That is nothing but the infection. So it is only after evading host's immune response they are able to cause the disease. So when the organism is multiplying causing a tissue damage, it is called as an infection. Now coming to the intoxication, it is the production of certain types of enzymes such as toxins. So these toxins are preformed, and when these toxins are taken up or consumed, they can lead to different types of infections. So here the toxins can be either an exotoxin or an endotoxin. Endotoxin is a characteristic feature of usually the gram-negative organism. This being a gram-positive organism produces only the exotoxin. So here the toxins, when they are consumed, they can cause the infection in the body, or they can cause the intoxication. Next, coming to the virulence features are the virulence factors that contribute to pathogenicity of the organism. The factors are classified into different types. First is the cell-associated polymers. Cell-associated polymers are nothing but the components belonging to the cell. First, coming to the cell wall, it is the peptidoglycan. Peptidoglycan gives a structural integrity and shape to the cell. So apart from that, it also helps in activating the complement system and leading to inflammatory cytokines that can be very deleterious to the human body. That is, abnormal secretion of these cytokines can cause the destruction to the host cell. Next is the teichoic acid, a component of the peptidoglycan layer. This organism, being a gram-positive organism, have more amount of teichoic acid. Now this teichoic acid is an adhesion component that protects from the phagocytosis. It binds to the cell and it inhibits the phagocytosis, or not allow the phagocytosis to take place. Next is the capsular polysaccharides, capsular polysaccharides. Certain strains of this organism have capsules around themselves, and because of these capsules they cannot easily undergo phagocytosis, that is they can escape phagocytosis and inhibits opsonization. Next are the proteins that are associated with the organism, which are called as the cell surface protein, the most prominent one being the protein A. The biological effects of this protein A are it brings about chemotaxis, antiphagocytic, anti-complementary in nature. And it also mediates the platelet damage and hypersensitivity reaction. And these protein A component that is present on the Staphylococcus aureus cell usually have receptors for the Fc of the antibody. So when the Fc receptor go and binds to this organism, the Feb portion is free to bind to any other antigen. So when they bind to respective antigens, they usually bring about the agglutination. So this is called as co-agglutination, and this phenomena of co-agglutination helps in grouping the Streptococcus organisms. And these are B cell mitogen, prominent B cell mitogen helps in inducing more amount of B cells that produces the antibodies. Next important factor is the clumping factor. It is a bound coagulase. The coagulase, the organism's characteristic feature is it is a coagulase positive. So the coagulase is usually present in the organism in two forms. One is a bound coagulase, the other one is a free coagulase. So this bound coagulase is the one that is helpful for us to identify the organism in a slide coagulase test. So they are the surface protein that are called as the bound coagulase, and when these bound coagulase are mixed with the plasma of the humans, they coagulate to show a positive reaction. So this is called as a slide coagulase positive test. And some of the organisms which are capsulated will not show this coagulase positive because the capsule hides this and will not allow the coagulase activity to take place. Next, coming to the extracellular enzymes which are present in the organism, which indicates the virulence of this organism. They are called as coagulase. So as already discussed, coagulase are of two types, bound and free coagulase. So for the slide agglutination test, you can go with the bound coagulate, and for the tube agglutination test, you can go for the free coagulase that is present in the organism. This is released into the medium. So the coagulase brings about its activity by binding with a coagulase reacting factor present in the serum or the plasma of the human. So when these reacts, they go and bind to prothrombin, and they convert the fibrinogen into the fibrin. That is the reason they bring about the coagulase positive reaction. The formation of the fibrin is a coagulase positive reaction. So it is how the coagulase usually interacts with the coagulase reacting factor CRF present in the plasma, and they bring about the positive test in the coagulase positive reaction. So this kind of reaction also takes place in the human body, that is allowing the biogenic infection to spread from one portion of the body to the other portion. Next are the lipases. Lipases are lipolytic enzymes that are present in the organism. Because of the presence of this lipid hydrolysis, they are able to cause skin and mucous infections. And next is hyaluronidase. Hyaluronic acid is a cementing material present between the two cells. Now the production of this hyaluronidase breaks away the cementing material, and this helps in spread of infection from one part of the body to the other part. And next is the staphylokinase, which is a fatty acid modifying enzyme that modifies the fatty acid that are present in the cells, and with the help of proteases they can initiate and spread the infections. Nucleases, as I told you, it is a characteristic feature of Staphylococcus. They are highly stable or thermostable enzymes, and the protein receptors of these organisms are the one that have receptors toward the fibrinolectin, fibrinogen, IgG and C1q. So it is because of the C1q receptor that they have, they can activate the complement system and can mediate the release of the inflammatory cytokines. Next are the toxins. So intoxication is usually brought about by the toxins that are released by this organism. So these are called as the cytolytic toxins that causes the damage to the cells, and they are divided into 4 toxins, and one is a leukocidin. First one is alpha hemolysin, beta hemolysin, gamma hemolysin, and delta hemolysin. Coming to the alpha hemolysin, it is activated only at 100 degrees centigrade and gets inactivated at 70 degrees centigrade. So it is due to the factor that at 70 degrees centigrade the inactivating enzyme goes and binds to it. Once they are bought at 100 degrees centigrade, the inactive protein gets separated, and this toxin gets activated at 100 degrees centigrade. Coming to the beta hemolysin, it is a sphingomyelinase and can lyse the RBCs of the sheeps, etc. And coming to the gamma globulin, it consists of 2 factors that helps in its activity. Delta hemolysin acts as a detergent on the erythrocytes, the macrophages, or the platelets, or lysosome, etc. Similarly, alpha hemolysin also acts upon the muscle cells, or the erythrocytes, leukocytes, lymphocytes, lysosomal cells, etc. Now coming to the leukocidin, is also called as a Panton valentine toxin, and it is having the characteristic features similar to that of the gamma hemolysin, having 2 factors. One is a S factor and the other one is a F factor, and these factors are helpful in its activity to cause the lysis of the leukocytes. Now this is the bicompound which is present in the leukocidin and the gamma hemolysin. The strains are called as hymenotrophic toxins because they have a bicompound that recognizes that helps in carrying out its activity. It is called as a hymenotrophic toxins. Now coming to the enterotoxins that is released by this organism, these toxins are called as the staphylococcus food poisoning, and the intoxication leads to nausea, vomiting, and diarrhea, and it is a heat stable toxin when compared to that of the endotoxin, which is heat labile, and they are mostly produced by the strains of the organism that grow in carbohydrate and the protein food, and they can also be seen in the food components such as meat, fish, milk, and milk product. When they are boiled and kept with the organisms, the organism produces the toxin, and they can be accumulated at more amount that it is able to mount an pathogenic disease in the person who is consuming that particular food that has not been refrigerated or kept outside. And the source of this infection are usually the food handlers. And 8 different types of these enterotoxins are known from A, B, C, 1, 2, 3, D, E, and H. And the target here for this enterotoxin is the autonomic nervous system, but not the gastrointestinal mucosa. So the symptoms that are seen is not due to the effect of the enterotoxin on the gastrointestinal mucosa, but because they go and act upon the autonomic nervous system. So all the symptoms are related to the autonomic nervous system. And here in the case of this patient, you can see the antibodies towards the enterotoxin, which are called as the antitoxin. So you can easily detect this antitoxin with the help of latest agglutination test or the ELISA. So that are the serological tests that are usually used to identify. And this disease is usually self-limiting. You can overcome that particular disease within 3 to 4 days. Next is a toxic shock syndrome, that is called as a TSST, and it is a fatal multi-system disorder or the disease that is caused by this toxin. So it is involving the whole body of a particular patient, and the symptom associated with that is a fever, vomiting, myalgia, hypotension, diarrhea, and mucosal hyperemia and erythematous rash, with these commits within days. And the infection over here, or the target here, is the mucosal or the sequestered sites, and the organism that usually produces this toxic shock syndrome toxin is the Staphylococcus aureus bacteriophage group 1, and the Staphylococcus aureus enterotoxin plus the TSST, if they are present together, they act as super antigen. Now, the super antigen is the one that can dysregulate the immune response. They can activate the T cells non-specifically to produce an hyperimmune response that is causing the damage to the whole body, ultimately leading to the death. So the super antigen is usually formed when the Staphylococcus enterotoxin and TSST are together in the patient. Next is the exfoliative epidermolytic toxin, also called as exfoliatin. So this is the one that causes the staphylococcus scalded skin syndrome, which is called as the SSSS. And here in that case of this patient, the toxin usually removes the upper layer of the epidermis, or separates the upper layer of the epidermis from the underdermal layers. Now here in the case of this, the infant shows this kind of symptom. It is called as a Retter's syndrome seen in the newborn, and in the older it is called as a toxic epidermal necrolysis, and the milder form of it is called as a pemphigus neonatalum or bullous impetigo. Coming to the staphylococcal diseases, previously we have seen the pathogenesis due to the exotoxins that are produced by the organism and the enzymes involved in the pathogenesis. Now the diseases associated with the staphylococcal organism is they mostly cause the bacterial infection. They are the common bacterial infections, and involved in localized pyogenic infections or the suppurative infections. In contrast to streptococcus, which usually spreads due to the enzyme that it produces. So here in the case of staphylococcal group of infection, they are mostly localized and causes localized infections or the pyogenic infections. First and the foremost is the skin and the soft tissue infections or the diseases caused by staphylococci. This includes folliculitis, carbuncles, furuncles, abscesses, impetigo or parenchyma. Next is musculoskeletal, involving the muscles and the skeletals, can lead to osteomyelitis, arthritis, bursitis and pyomyositis. Next is the respiratory diseases that are associated with this organism is tonsillitis, pharyngitis, bronchopneumonia, sinusitis. You have lung abscesses and empyema, that is clogging due to the pus formation. And involving the central nervous system, it can cause abscesses, meningitis, intracranial thrombophlebitis. And endovascular, this organism entering the system can lead to bacteremia, septicemia, pyemia and endocarditis. Coming to the urinary, these organisms are hardly seen in the urinary tract infections. They can be seen only when there is an implantation of catheters or in diabetic patients. But the significance is of this organism helps to identify whether there is a bacteremia in the patient or not. So these are the different diseases associated with the staphylococcus organism. Coming to the bacteriophage typing, bacteriophage typing is usually done to identify the epidemic strain that is causing the epidemics in a particular area. So bacteriophage typing is nothing but the organism is susceptible to certain types of viruses. So when a plate containing the organism, that is a crowd plate containing the organism, is inoculated with a specific strain of viruses, the zone of lysis helps to identify to which strain it is susceptible and helps in the bacteriophage typing. So this bacteriophage typing is mostly for the epidemiological purposes to identify the organism. Next is the epidemiology, how is the spread and the transmission of this organism. The source, this organism is usually a common parasite present in the body, and the source of infection is the humans, or either due to the direct contact or use of fomites or the other material that have been contaminated with the organism. Mostly the upper respiratory tract infections, or the person who is having the upper respiratory tract infection or the local suppurative infection can transmit the diseases. And most of the carriers usually harbors this type of organism, and they act as shredders who shed this organism continuously in the environment, leading to the disease of the different individuals. And this organism can either be due to endogenous or exogenous infection. Endogenous infection because due to the breakdown of the immune response, this organism can become opportunistic pathogen and cause the infection and can be transmitting it to the other person. Exogenous from the external environment. And these organisms are mostly involved in post-operative wound infections, and they are the one that are involved in the cross infection in the hospital. And most of these organisms have developed resistance towards different types of antibiotics, and when these organisms are seen in the hospital, they are usually called as the epidemic strain, and the treatment of this is very difficult because they have not developed resistance against only one antibiotic but towards different types of antibiotic. So once we have identified the strain, then you can go with the treatment purpose and the measures for the control to bring about the decrease in the infection that are acquired during the hospital stay is usually by taking care of certain things before going for the treatment. First is isolation of the patient, that is once the patient have been isolated to be is suffering from this particular infection, he has to be isolated in an isolation ward and he has to be treated in the isolation ward. Next is detection in the hospital of the nurses or the surgeons or any other maids that are usually harboring the organism and are infected with this organism. So you have to detect them and you have to treat them separately and should not allow them to go for the work till the treatment has been completed. And aseptic techniques has to be very well taken care in the operation theatre, because most of these organisms are involved in post-operative abscesses. So aseptic conditions have to be very well maintained in the operation theatres. Next is once the carrier has been identified, he has to be isolated and then treated with neomycin or the chlorhexidine. Coming to the lab diagnosis, how can we identify this organism in the lab? The specimen depends upon the type of lesion that organism is producing, whether it is a local infection or suppurative infection. In that case, you can go with the pus collection or sputum in the case of respiratory tract infections, and feces in the case of food poisoning, because this organism is involved in toxic shock syndrome symptoms of food poisoning. The organism can be isolated even in the feces, but case should be taken when we are going with the sputum test because most of these organisms are the normal commensals and hence can cause a confusion in the diagnosis. And in case of carriers, the nasal swabs are the best source of collection of the specimen to identify the carrier who is carrying this particular infection. Next is in the laboratory, first go for the microscopy examination of the gram-positive organism in clusters or in grape-like clusters with the help of pus, and gram staining helps us to go for the initial identification, but you cannot completely rely on it because again there might be a confusion because most of these organisms are commensals and can be inhabited by different groups of organisms, gram positive organisms. The best method is to go for the blood culture. As soon as the sample is received in the laboratory, immediately inoculate under the blood agar and go for the isolation of the colonies on the blood agar. The typical characteristics that we see helps in identification of the organism. Once the organism has been isolated in blood agar, you can go with the selective medium for the final identification of the organism. Here the selective medium is a Ludlam's medium, salt milk agar, or you can go with Robertson's cooked medium containing 10% NaCl. So they selectively isolate the organism which is staphylococcus related to that particular disease. Next best method to identify this organism is a coagulase test. The only organism that is coagulase positive is staphylococcus. So the coagulase is an enzyme that is present in the organism. Both bound coagulase and free coagulase can be seen in this organism. That is, they can produce coagulase which is bound and free. So based upon which type of coagulase we want to identify, we can go for tube coagulase test or slide coagulase test. For the tube coagulase test, it helps in identifying the free coagulase that is released into the medium, and in this technique we can add 0.1 ml of the coagulase to the 0.5 ml of the human plasma or the rabbit plasma and incubate it for 37 degrees centigrade, and positive and negative controls have to be set. If the plasma has been coagulated, it will not fall if it till the tube, so that indicates a positive reaction. Now coming to the slide coagulase test, which is more important when compared to the tube coagulase test. Here we carry out this test in a slide where we mix equal amount of the human plasma along with the coagulase, and there is a there is a clumping that indicates a positive reaction. So Coagulase test is the best method to identify staphylococcus group of organism in the laboratory. Next, you can go for antibiotic sensitivity testing, because most of these organisms are sensitive towards different types of antibiotics. Antibiotic sensitivity test helps in identification of the organism and also for the treatment purpose. That is, which strain is sensitive towards which type of antibiotics helps in the treatment purpose. Next, for bacteriophage typing, as already discussed, they are mostly used for classifying the organism epidemiologically or identifying an epidemic strain. You can go for bacteriophage typing. And we have antibiogram patterns, or you can go for plasmid profile, DNA fingerprinting, ribotyping, and PCR, which all are the most sophisticated technique to identify this organism. And apart from that, you can go with serological tests, where these serological tests are mostly used for identifying the organism in hidden deep infections. And here we have anti-staphylolysin antibody titer greater than 2 units is taken as a positive test for identifying the staphylococcal infection. Coming to the treatment aspect, here the organism can be treated with the different types of antibiotic, but the problem over here is that these organisms have developed drug resistant towards different types of antibiotics. So initially benzyl penicillium was the best method of choice to treat the infection, and because these organisms have started producing beta-lactamase enzyme and inhibits the penicillin activity, they have been shifted to the treatment or administration of methicillin. And in order to limit the use of methicillin, you can also go with cloxacillin. Recently it was found that methicillin resistant staphylococcus aureus or MRSA strains have also been identified, that has developed resistance not only towards methicillin but against different types of beta-lactam antibiotics. Coming to the mild superficial infections, here systemic antibiotics are mostly used to treat the infection, and for life-threatening infection can go for vancomycin. Topical application is not suggested in the case of staphylococcal infection, but it is mostly used in the carriers who carries the infection. So in the carriers, their local application of the bezitracin and chlorhexidine is mostly used to reduce the infections. And the drug tolerance is a very important concept, because the organism has tolerated the drug, that is, it is getting inhibited but not killing the organism. So the drug, when you are going for antimicrobial susceptibility test, the minimum inhibitory concentration should be greater in the dosage when you are giving, because at that particular minimum inhibitory concentration it is inhibiting the organism. So when you increase the dose, you are completely killing the organism. So drug tolerance is an important concept we have to keep in mind when we are giving the dosage, because most of the organism has tolerated the drug to an extent that it is not getting killed but it has been inactivated. Next is in the resistant cases, in the carriers you can go for rifampicin treatment. Now coming to the other group of staphylococci, that is the Coagulase negative staphylococci, and these organisms are mostly the normal flora and act as normal commensals of the human respiratory tract or the human body. Examples of these organisms are Staph epidermidis, hemolyticus, and saprophyticus. Here the Staph epidermidis is an opportunistic pathogen and mostly involved in the infection of the stitch abscesses or implanted foreign bodies, such as the prosthetic valves or the catheters, etc. So these organisms, once the immune system comes down, they can act as opportunistic pathogen and can cause the infection leading to bacteremia. And most of these organisms have developed resistance against different types of antibiotics, and hence they are called as multiple drug resistant bacteria, and mostly involved in cystitis and endocarditis in the patients or the person who are drug addicts. Coming to the Staphylococcus saprophyticus, these are again common flora of the skin or periurethral areas, and mostly lead to urinary tract infections, and they are the normal flora in usually the females, and these type of infections are symptomatic in nature, and they cause the infection of the upper respiratory tract. In men it is very rare, this type of infection cannot be seen, but in old people the Staphylococcus saprophyticus infections are mostly seen, and the organism is susceptible to nalidixic acid but resistant to novobiocin. Coming to the last group of staphylococci, which are also called as the micrococci. These are gram-positive cocci similar to that of the staphylococci. They occur in tetrads, pairs and irregular clusters, where we can see as staphylococci in a regular cluster. They are in the form of irregular clusters. So they were thought to be similar to that of staphylococci, but because they have certain different biochemical reactions, they have been classified as micrococci. And these organisms are catalase and oxidase positive. They are aerobic and they are parasites usually on the mammalian skin and non-pathogenic in nature. And the way that you identify is with the help of gram staining, where these cells are usually larger when compared to that of the staphylococcus group of organism, and they are irregular in clusters. And the best method to differentiate between the staphylococci and the micrococci is the Hugh and Lipson's oxidation fermentation reaction, where these organisms are oxidative in nature and staphylococci are fermentative in nature. So this is about the staphylo group of organisms.